What's up? Welcome to In the Moment. I'm Dr. Brett Jones at the Source Chiropractic in Oakland, California, and today we're joined by Chloe. And Chloe's here all the way from Paris, France. She's actually a chiropractic student at a school called IFEC, and you've been training with Kairos Training Culture, correct?
Yes.
Yeah, and now out here to come to see how we do things out here in Oakland, and excited to have you today observing. What did you notice as you were observing the flow of the Source Chiropractic?
It was like being at the camp.
Like being at the camp.
Yes.
In what way? What'd you see? What'd you notice?
I don't know. I never seen like everyone working in the same space.
Right.
So it was like great energy, and really like go with the flow and just.
Right.
Yeah.
And I think people are surprised. Sometimes they see the in the flow adjusting videos and are surprised that that's pretty much exactly how we adjust. There'll be some conversation here and there, but ultimately we are present and connected, and we can have multiple chiropractors adjusting at one time, and it's been a beautiful place to be. Chloe has some things going on, has some previous head injuries, I think you said from horseback riding and skiing, and can experience right side tingling numbness on the face, and then going down the arm and into the fingers, and into the legs, so all right side. So has some previous concussions, tingling and numbness, and then, was there anything else?
Yes, like my eyes.
Yeah.
Sensitive to lighting.
Eyes can be sensitive to light, and there was also brain fog,
Yeah.
right? Okay, cool. So it's been a minute since I've actually talked through an adjustment. So I'm gonna do that. Go ahead and go face down for me. Okay. So, in the flow, everything is happening really fast, and some can perceive that there's not much of an analysis, and that's a perception. There is an in-depth analysis. It's just happening very quickly due to time, repetition, and stages of progression in analysis and discovery. All right, so Chloe lays down on the table. What do I notice? Well, I notice right leg is short, and I notice that there's also a tilt, right? You see that, a tilt of the right leg. That could be indicating cord torsion. It could be indicating a potential pelvic listing. So I'm gonna follow the leg up to the pelvis and see if there's any types of rotations. If you have external foot flare, it's typically an internal rotated pelvis. So that could be it, but it's not just external foot flare. You actually have an eversion. So let's go ahead and check with just a tensional test. So as I pull the heel, I'm checking how does that tension, because basically I'm tensioning the entire system, how does that travel the system? A lot more tension on the right. Achilles is a lot tighter on the right. And if you notice, she's complaining about a lot of right-sided symptoms. So in general, there is more tonicity or tautness of right Achilles, of the right cord. We have a posterior right occiput, which we will adjust here soon. Carries a lot of tone and tension in the upper thoracic, so we have accentuated curvature or kyphosis that comes T1, T2, T3 is pretty much the apex, where typically it's down lower. It's typically like T7, T8. So to have this much, what I'm thinking about is a system that has gone up in its kyphosis, which is can be associated with a lot of fear and anxiety. So, and also when I look at her pupils, the pupils are hyperdilated, which means that there can be a dominant sympathetic tone. And I'm finding more and more that sympathetic tone has a fear and anxiety component. So now you get into the emotional dynamics of changes in spinal distortion and changes in people's physiology and posture. So this is an apex, but doesn't mean that it needs to be adjusted there. I'm looking now for access, and access is found by finding resonant tone. So a lot of the palpation that we do is tonal. And also, if you notice, if I just go straight inferior to superior, I increase that hunch of the shoulders. So what I would like to do is find a way in the setup to actually bring, let's actually make this better so you can see a little bit better. I want, the shoulders are going forward and up. I want to see how in a setup, is there a potential to help the shoulders go down and finding closer to a better neutral or more ease and peace in the system. And so I'm actually compressing S to I, which is counterintuitive. I'm bringing the shoulders down, and then I'm opening the facets there. So now I'm actually closer to neutral, but I had to start S to I. Take a breath, let it out. Big movement. If you noticed, I did not thrust at the breath all the way out. I listened for the open window and went with the open window. Also called the kairos. That opportune moment when an opening appears in which a force must be driven through for success to be achieved. Now we're C7, T1, first rib, so actually more first rib. Oh, perfect. Perfect. Things are starting to open. Okay, recheck the legs here. So now I can still see that eversion and external foot flare. Definitely seeing it in the pelvis even more clear now. If I pull up the shirt just to the jean line, you can see that this is both higher and rotated in. So it's called like a PI-in. Leg does go from short to even, so that gives us another indicator that yes, it is a potential posterior rotation. For PI-in, you can put it involved side down. I'm gonna go ahead and go involved side up. So go this side up for me, you'll face me this way. How are we doing so far? Good, all right. So funny, I usually don't talk when I'm adjusting. But we can do that. Okay, so we need to go I to S, P to A, and internal to external, and all while seeing which order. So that can be done in the first order of going IN to EX, or first order of going mainly P to A, or first order of mainly going I to S, and all micro test different vectors. Okay, I'm like, oh yeah, that's nice. So that the medial to lateral is a good start. And then, all right, then P to A, I to S, there it is, and roll. Got it. Goes face down. So I'm learning is that, you know, and even BJ Palmer said, oh, look at that pelvis. You're perfect. Big change. So BJ Palmer said that every subluxation is a torque subluxation in 3 different vectors, right? That you can't have linear subluxations, all has a component of torque. And so that means when you're going to connect and then delivering an adjustment, it needs to go in basically has to have a multi-planar motion of delivery of your impulse. And that often means putting a torque component, putting the posterior to anterior usually, right? A lateral to medial, and then a level of torque. So if you're talking about with the orthogonal listings, there's gonna be a Z-axis, a Y-axis, and an X-axis of motion being introduced into the joint. All right, that is much cleaner, much better. Go ahead and check the lumbar. Sometimes when you have a really rotated pelvis and you clear that as a primary, you need to follow up with a lumbar adjustment. Overall, we're actually doing pretty dang good. So go ahead and roll to your back for me. All right. That feel good after taking some big plane rides, huh? All right. So upon evaluation before we did this video, by the way, that's one of the questions that a lot of people have. They'll watch some of the flow videos. Anybody that comes into the Source Chiropractic for care, which we usually have a care plan, undergoes a full functional analysis. It's a 30 to 45 minute functional analysis where we're checking range of motion, we're doing digital posture, we're checking their gait, their overhead squat. We do some other chiropractic functional assessment tests, and orthopedic tests when necessary. And then based on that analysis, we're coming up with specific care plans to get them started in care. And those care plans are typically anywhere from 3-month to 6-month care plans. Except for the people that are flying in for care, what we've created is the healing immersions, and in the healing immersions is an opportunity for us to see a person multiple times in a day to achieve what we've been achieving within 3 to 6 months of care. So now that goes anywhere from 1 to 3 weeks. Again, that's called the healing immersion. So for those that had any questions there. So upon checking Chloe's neck, that first rib adjustment that we did when she was prone has helped a lot. We still have a good amount of dissonance, or you could call it distortion or derangement at the upper neck. The base of the skull is called the occiput. It is superior, meaning headward, and posterior. So we need to scoop down. And while I'm doing this, I'm being mindful of the cranial system. Right there. Good. Now, since we already got a big release on the right side of the neck with the first rib adjustment, you're not going to hear a huge audible, and that's okay. Now we're going to adjust C2. There we go. That's what we wanted. And then we recheck the tone of the entire neck. Bend your knees for me. Okay, when the knees are bent, it takes a lot of load off the upper cervicals. Checking ribs and clavicle, a little tight on the SC joint. I've been doing some SC adjustments, but for right now, mainly clear with that first rib adjustment, so I'm just gonna do a little bit with this activator. Just right underneath the clavicle, going into the second rib, and then near the sternum. Cool, let your legs go long. So we recheck the feet. Okay, so I'm learning now that part of what we were seeing when she was prone was not only the pelvis, but now the foot or ankle is actually subluxated. It's a anterior lateral talus, which is basically creating that foot torque that we were seeing when she was laying on her stomach, which over time created the pelvis, or the pelvis created the ankle. I don't know which came first, but they're both jacked up. So we're gonna now adjust the ankle. And this has caused a lot of tightness around this interosseous membrane that is in between the tibia and the fibula. So all along this is super tight. So we're gonna see how I need to distract the ankle to engage this to get release in the membrane through the adjustment. So it's right there, got it. Yeah, that ankle had been jammed up. I'm actually gonna go one level more distal. So that was more talus, now we're at the navicular. That was even better. Yeah, your ankle needs some love. Okay. There we go. A lot more mobility. That should be a lot better on the pelvis. Come on up. How was your adjustment?
So good.
So good. And when do you graduate?
In a year.
In 1 year? And you'll be practicing in Paris?
I don't know.
You're telling, so would you recommend people come to the Source Chiropractic?
Yes, definitely.
All right, thanks everybody for tuning in. I hope that was helpful. Again, talking for the first time in a long time here on the tube. I love you, appreciate you. Until next time, peace.